Sandy, you're live.
Welcome to the Eureka Springs Hospital Commission regular meeting, August 18th, 2025. We'll have roll call, please.
Sharon Doremus, Commissioner.
David Carlisle, Commissioner.
Willie Daniels, Commissioner.
Kate Dreyer, Secretary.
Brian Byler, Vice Chair.
Sandy Martin, Chair. Vivian?
Vivian Smith, Commissioner.
Jody Edmondson, HR Director.
Cynthia Asbury, CFO.
Velvet Schultz, Clinical Director.
Okay, we are 100%. Thank you all for showing up. Now I'll entertain a motion to approve the minutes from our July 21st meeting.
I so move.
I have a second.
Second.
Second. All in favor?
Aye.
Any opposed? None stated. Motion carried. Approval for today's agenda. Any additions, deletions, changes? If none, do I have a motion to approve?
So moved.
I have a second.
Second.
Dave, thank you. All in favor?
Aye.
Aye.
Any opposed? Okay. Public comments. Do we have any public comments? None. We have one public. Thank you for coming. CEO report. Tiffany is literally on a plane, but she did give me a brief update that I'll read into the record. She says, I am still assessing and have met with all leaders last week one-on-one. Met with our attorney, Gabe Mallard, and discussed outpatient clinics and current contracts. We are actively recruiting jobs posted on our website, and we have replaced a couple of contract employees with PRNs, and we're still interviewing, and I think Velvet will probably have an update on that a little later on. So that is the CEO report. And CFO report. Cynthia.
So the first page is just cover sheet. Next page is our bank account balances ending July 31. We were down about 9% for the month. Some of that is timing variables, invoices being paid, claims being paid, processed. Next page is revenue by cost center for service dates for July.
Sandy,
Yes.
excuse me, can they speak into the microphone, please, because I'm having a hard time hearing that.
She is speaking into the microphone.
I'll watch it on YouTube after.
Well, no, wait a minute. Let me put my phone closer to her when she's speaking and see if that helps you.
So the next page was revenue by cost center for service date. Kind of comparably see it. Our total charge, billable revenue is down a little bit compared to where we were for June. But, charge is there. So, we had a great month of July overall for volume, patient visits. Next page is our income statement for the month of July. Everything kind of there aligns. We had a profit of $87,000 for the month of July. Some expenses in July we had some contracts, some invoices that we paid that aren't typical every month ones from wrapping up our audit from Forbes and stuff like that impacted our, overall profit for the month. So, and as any time you have questions, we can definitely look into any of those further. And the next page is our balance sheet. I made sure the header printed on there for you this time, Sandy. So
Thank you. Good.
And then-
That's 3 profitable months in a row.
correct, yes.
Which is extremely encouraging.
And then we tentatively wrapped up our audit with Forbes last week. We got the drafts to review and approve. They have given us 3 tentative dates. They can come present that for the commission. It'll be September 22nd, September 23rd, or September 24th, which is a Monday, Tuesday, or Wednesday in September, and they can come present the board. So just whatever date of that, and then I can get back and let them know which day works best. So,
Is there a date, because we need to coordinate this obviously
Right.
with City Council, we'll be calling a special meeting that will be strictly discussing the Forbes 2024 audit. Is there a date out of those 3 that are preference to the commission?
What were the dates again?
September 22nd, 23rd, or 24th.
So that Monday, Tuesday, or Wednesday of that week.
Correct. He said if none of those worked, we could look at some dates in October. So we just,
I'm not affected by, I mean, either any of them work for me as far as we just need to see what council will agree to.
Okay.
What do you guys think? Kate, me in Jonesboro, maybe?
22nd is difficult for me.
Okay.
Okay. 23rd, 24th, everybody else?
Is that,
You're okay, Willie?
let's see, September?
I'll get back with you.
You're okay on the 23rd or 24th, Sharon is? Okay.
Should be. I don't see.
Are you okay?
I'd have no problems with either
I'm
of the,
sorry?
any of the dates are good for me.
Either one? Kate?
She's the
I'll
only
get
one.
back with you.
Okay.
So we need to look at the 23rd, 24th. You know what I mean? So
Yeah,
they say-
23rd or 24th. And if we're good, Cynthia, what date looks best for you?
I can do any of those dates. So
Any of those?
And it'd probably be, you think, morning get
probably in
together?
the morning time, correct? Yes. Probably like a 10 a.m. or something like that would probably
10
be.
a.m.? Then let me get, so far either date works. Kate, you're going to get back to me, but I will ask the council if either one of those dates work for them at 10 a.m. Okay? And then we'll go from there.
Okay.
Super. Thank you. Got that set. Okay. Any questions or comments for Cynthia? Really?
Oh, I love the charts and the colored lines.
I'm getting there.
They're great.
I'm getting there. And that's what I wanted to address on this and make a few comments that I think are important to put on the record. Once again, we find ourselves in the position of fact-checking and correcting statements made by City Council members during the July 22nd workshop and reported in the press. We were not invited to that workshop and could not respond or correct the statements. We are compelled to put the facts on public record. We have a workshop with City Council scheduled for this Thursday, the 21st, and we will repeat the facts at the public meeting and provide them with the backup that we're going to review today. To be clear, this is not a statement about the press. They report what they hear and see from the videos and transcripts. This is about council comments that are inaccurate and misleading the public. The first issue is the COVID funds, carried as a liability. We've answered this question publicly and reported on it several times. Our auditor, Forvis, recommended we carry it as a liability until such time we would not be subject to repayment. There were two primary conditions that would trigger repayment. One was if the hospital received any taxpayer dollars to operate the hospital. We do not, there's a bug. We do not receive any local, state, or federal taxpayer dollars to operate the hospital. The second condition was a time frame. They could only ask for repayment within the first 4 years after we received the funding. We passed that 4-year mark in April of 2025. We anticipate that Forvis will recommend eliminating that expense from our liabilities when they report the 2025 audit. Is that correct, Cynthia?
That is correct. And we have been in discussion with them to meet the criteria of what they're going to need to release us when they do our 2025 audit.
Thank you. The second thing is the commission checking account. The commission has had a separate checking account since 2004. The reason for the account is to have a reserve to pay bills that previous management companies weren't paying. It came in handy because some of the management companies forfeited it on payroll. The checking account in question was opened in 2018 and was reported on in the hospital financials through 12/31/22. And here is, and this has been provided to council, example of it, and I've circled the checking account, which was $16,901.01. The then CFO, Bill Couch, decided not to include it in the financials anymore because, in his opinion, no one at the hospital could access that account, and he presumed the funds were not available for the hospital operations. It is true that nobody at the hospital has access to the commission checking account, just commissioners, but it is still intended for hospital operations and expenses, which is what it was used for. he was incorrect in that, but anyway, it got eliminated from the financials. The balance was $16,901.01. The account in question was opened in 2018, and in this bank statement that we recently received from CS Bank, there was no activity until 2021 when a check for $118 was written. That was to cover a post office box and postage. In January of 2023, which you see here, there were 2 deposits. Actually, there were 3. February, right, 2023. They hit the wrong GL account. They hit the commission checking account when they should have hit the commission money market account. And those on the same day have been deposited in the correct account. So both transactions were corrected. That leaves a balance of the current $16,901.01. You're seeing a trend here. I have the checkbook that I've gone over that has every transaction from it being open with $5,000 showing the current budget of $16,901.01. Anybody that wants to look through this may look through it with the expenditures. I found them all to be extraordinarily legitimate, but you can look at that, all for hospital expenses. The commission checking account has always been balanced, bank balanced, and has always been included in every hospital audit. So there shouldn't be an issue with that anymore. The 2025 financials, a council person stated twice in their workshop that the hospital was operating, quote, operating at $370,000 a month loss. And she said she calculated financial losses averaging $366,226 per month for the past 5 months of a loss. False on both counts. You have a spreadsheet that we have been tracking for our last budget workshop, mid-year review, that you can clearly see at the profit and loss, the net operating profit and operating expense. There is not 1 month that hit a negative 366,000. Highest was 273,000. We have had 2, now 3 through July profitable months. May and June were 200,000 plus on that. So again, that stands to be corrected on that. We also track the percentage of our revenue by cost center on it, and it was also inferred that I kept saying that we're going in the right direction and things are going well. I repeat that. Things are going in the right direction, things are going well. To demonstrate that, you have 2 charts. The first one is a comparison of revenue, expenses, and profit, 2024 versus 2025, January through June. You can see the dip in the 2024 where the commission got very concerned, started getting more involved in the operations with the current administration. You can see the different in the trends in 2025 in comparison. Expenses down, revenue up, profit up. To have a more dramatic on the net revenue, because we keep saying that we're not making revenue, this is 2025. Again, the large dip. This is 2024, I'm sorry. And this is 2025. Again, I stand by the comment that I and several other commission members have made that we are going in the right direction. Regarding the $863,000 in construction, quote, construction in progress that we've been carrying. The construction in progress is architectural services and other fees that were approved by previous administrations and previous commissioners when they explored renovation of the existing hospital. These will be adjusted in the 2024 or 2025.
2024, we do have an adjustment journal entry.
Excellent. So it will be adjusted in 2024. As we advised Forvis, that is no longer an active project. We canned that project into '23. These expenses were from 2022 and 2023. There is no construction in progress. The total is cumulative, dating back for those several years. Last thing I want to address is the budget. The commission was criticized for failing to produce a revised budget for 2025, and a councilperson further claimed that we did not do a mid-year budget review. We did indeed do a mid-year budget review, as we had always planned to do, which was, we also did the first budget that the hospital has ever had. We did it in August of 2024. We were only in our REH conversion model for a couple of months, and we didn't really have a solid baseline at that point. So it was a best guess scenario. At our mid-year workshop, we elected not to revise the budget, but rather track the actuals and continue the cost-saving measures that the staff was already pursuing. We also felt it was prudent to wait until our CEO was in place to get her direction on revenue-generating opportunities and further cost savings ideas. 2025 will give us a far better baseline and better inform the CEO, the staff, and the commission on the development of the 2026 budget. As stated in state and local law and the Hospital Commission bylaws, the hospital budget is the business of the commission and the CEO and the staff only. It is our job to do the budget and our job to make sure that we stick with the budget and revise the budget. So we do know that it's going to be fluid. It's still going to be fluid. We have a whole bunch of unknowns in 2026, Medicare and Medicaid. So I defy anybody to sit down and say they can project anything. We just have to stay on top of it. And we may have a section up to the commission to decide, but when we get into the budget, probably October of this year with Tiffany and the staff, we might decide every workshop will allocate 15 minutes to a budget review. I think that might be a wise decision. But, those are my comments. I felt it was necessary on all of our behalfs to keep correcting the public record and getting the facts out and leading with some charts and graphs and some material that can be FOIA'd easily that we would welcome.
Absolutely.
Question.
Yes, ma'am.
The 273,000 that we were in the red early this year, that it seems that I recall that was the month that we had the biggest IT install. That's
On
That was in
March.
Was it
Yeah.
March?
I think it was March. We did, and we had the Oracle invoices as well to pay, but yes.
yeah, okay.
We
was
took a big
February.
hit. We took a big hit based on that, the Oracle. Right?
Right, it was the IT, right.
remember us
and
talking
then we
about that.
had,
Purchased the IT equipment because we had to buy the equipment itself for the new server farm, yes.
yeah. And then the other question is for Sandy, your item by item response that you have written, can that written account be included with the graphs that go to every council person?
Yes, I'm going to bring all of this to the meeting. In fact, we might respond. We did get some questions via the finance director at the city from the council person. We're in the process of answering those. The majority of them we've addressed here.
That's what I'm saying. Just the black and white, that can be stapled with everything there and put in their inbox.
Yes, ma'am.
Great. Thank you. It was a great presentation.
Any
No question.
additions?
No.
When did we write the large check to Oracle?
Into February 1st. It was in March, I think, is when it cleared. The bank account was March,
Okay.
if I'm
Yeah, we had
remembering correct.
Right, so we had the updated payment to Oracle. We had the IT bill. Those were the two major things, I believe, that we dealt with in March.
No, on the Pinnacle, if I understand, we had to pay out in chunks and groups. The Oracle was a $560,000
And I think that
check.
the expense hit in February.
And that was the
From just
catch-up
thinking
with
of
Oracle due to the...
Conversion and the
Right,
implementation.
the issues
And then-
previous that we dealt with and that we're just finally getting that final
Yes.
check to get us cleared and get us going forward
Yes.
on a
Yes.
monthly basis. So that was I don't know, we're talking about a year? I mean, I think I look back at the
Yeah.
Oracle thing, it was
It
probably
was a
about
little
a
over a year, 'cause
Yeah.
it was actually all of the
So-
the 9 months of pre-conversion kind of work that went in as well.
So if you
as
divide it
census.
out by the month, if we had been able to go back and look at every month and pay it out, of course, we'd have absorbed
Yeah.
it then versus having one big dump like we did in March.
Yeah.
Okay.
I
And-
think that
and
that
to-
check was at February, and then I think the Cerner equipment check hit, or excuse me, the IT equipment hit in March, but we can look at the exact
Okay.
date timing
But
of those.
but we know it's those two things,
Yes,
and
those
and we
two,
know they were
right.
basically not a very abnormal situation that we spent that kind of money based on those
And
two
we
things.
anticipated it.
Yeah, absolutely, absolutely.
And just as clarification on the Oracle, the chunk came out, obviously, of our money, but Cynthia retroactively allocated the expense.
The expenses were put to the date for what they were for, but yeah, I mean, the IT was a capital expenditure we anticipated and had been anticipating for well over a year, just didn't have the right people in place to get us the fine-tuned number on paper
Right.
of what it was going to take that we needed, so.
So you're saying they were recorded sort of retroactively at previous times?
Just the invoices were recorded for the actual invoice service dates, but the payment and the expense hit in
Right.
that month, correct?
Was made much later?
Yes, yes.
Yeah.
My sole reason for asking was to remind the public what that big chunk
Right.
was about. Thank you.
And I mean, we're currently pretty much in our budget now, or I mean, our monthly expenses, we're absorbing that cost is every month now, correct?
Correct,
So instead of all one big lump, it's all coming in.
correct.
Yes.
And we anticipated the catch-up for Oracle.
Right.
We did not anticipate the Pinnacle.
Yeah, that's
To
right.
that extent. I mean, we knew we would have to invest in some technology, but not to the tune that we had to do,
Right, the IT was based on basically the system we had was just not up to standard at all for what we needed as a hospital to operate.
Correct.
And therefore, we had to spend the money to get our ducks in a row.
And we've
security
already had to put equipment into use prior to initial even install date, just because we've had critical system structures kind of go down and stuff. So, I mean, they've been working to start getting phases of it implemented to help
Yeah, well,
ensure our, smooth operations of our day-to-day, so.
we haven't really talked about, but I'm assuming everything seems to be going along though very well, or pretty well with our IT and everything. It seems to be.
Absolutely, very
Okay.
impressed, very great, knowledgeable,
So the investment obviously is paying off.
absolutely.
Okay.
So basically, it was obsolete, worn out, and absolutely had to be replaced.
Absolutely.
In a short period, and that's why it
Yes.
comes stumbling in at that date.
Correct.
It had a lot of security holes, too,
Right.
which we
Right.
can't afford.
Obsolete. Yeah.
And we were running out of room to put data, right?
Correct.
We were just limping along.
Correct.
Any other questions or comments? Anybody? Velvet, what's new in clinical and trauma in your world?
Clinical-wise, we continue to hire nurses and paramedics. We have 4 more interviews on Thursday for nurse paramedics. I think Jody mentioned we're down 2 contract labor. So we've cut out 2 of our travelers, 1 at night, 1 during the day. And the plan is to continue to vet them out as their contracts expire going into the spring, into the fall. And we've opened up the options for local contractors and what they call it seasonal contractors. So we're nurses or medics that live in this area, want to do a travel contract, but they want to stay home. They contract with us for 13 weeks. They don't actually have to go somewhere to do that, but it makes them our employee. So we're kind of thrown that out there to see what kind of interest so far. The interest has been pretty good because there's not a lot of places right now doing seasonal contracts in this area. So obviously labor continues to be our number 1 priority, try to get nursing to get away from our contract labor, get our expenses down. Continuing to look at the medics is a great option. There are 3 of the interviews on Thursday are all paramedics. With flight medics and some of the retired fire department guys that were division chiefs and training officers, so the experience is definitely desirable for us. From a trauma standpoint, we're given our full trauma grant for 2026, $45,000. I think is it 45 or 40? thought it was 45. I'll have to check to make sure, because they took out education in 26. The 2025 included education money, and the state has taken that out for this year, so that's why I'm not sure, but I think it's 40,000, but we were granted full grant for that to use for whatever we need to for trauma-related care.
So again, I'm hearing you're saying that this money was a grant money, so nice little extra added.
Absolutely, and it's a reimbursement grant, so anything we spend doing trauma care, which is supplies, equipment, personnel, education, operations, we can use it for anything that's trauma-related, which in our world is pretty much everything that we do.
Yeah, categories.
And what do we typically spend the bulk of that money on?
It just depends, supplies, equipment, and, if we can see toward the end of our fiscal year that we're not, at the state's fiscal year, that we're not going to have, we didn't need any more supplies, didn't need any more equipment, we'll use it to reimburse salaries with.
Oh, okay. Okay, so.
We never give it back.
Correct. Okay.
You find a
Equipment,
place to-
supplies first, and then salaries. Excellent. Excellent.
That's all I have, Sandy, from a clinical standpoint.
All right. How's our census been lately?
It's still tourist season, so it continues to stay kind of high. The weekend was very busy. The EMS volume continues to be up. At the end of this month, we'll be able to provide you guys with some quarterly volumes that you can look at, EMS, what happens during the day, what at night, and that kind of thing, so you can look at.
Cool, awesome.
It'd be great if we could get to like a standardized report of traffic tracking, and you can go back and retroactively pick up January, right?
I can go back through our electronic health record and run volumes for the month, give it dates and volumes and how did they arrive, private vehicle or EMS.
I know we had some issues with the electronic medical record with verifying the 2023 and 24,
right?
But we're clean by picking up 2025?
As far as we know.
Yes.
As far as we know.
Yes.
Yep. Okay. Excellent.
I guess my only question, and it goes back to Oracle, I know we had the issues of basically the wrong information or not putting information into the system to help our doctors, nurses, and basically fill out their forms or do their stuff. Has that smoothed over? Are we doing a lot better with that? Am I making sense when I'm talking about
Yeah. Tiffany, there's a team involved. Tiffany's involved as well, working to kind of correct a lot of these documentation things that are just the cookie cutter out of the box template we have of Oracle for the clinical side.
So the templates are looking better. We seem to be getting more organized there?
No, but we've got the right people engaged, we feel like now, to start making some traction with Oracle.
So we're anticipating that the format you see when you're trying to put stuff in there isn't just generic.
Correct.
Something's wrong, as opposed to specifics, yeah.
Yes.
Oh, it's 100% wrong. I can tell you. It's the equivalent of I went to Best Buy and bought a laptop and I took it out of the box and turned it on and just started using it. I didn't download Microsoft Office. I didn't put my name in so it says hello, Velvet. Yeah, nothing.
That makes it clear.
Nothing. Yeah. So it needs to be tailored to our business.
Yeah.
But we're making progress there, right? To try to do that so that Velvet is happy when it says hello to her when she talks to it. Okay. Just
Our goal is to make Velvet happy, believe me.
Well, I ought to be able to chart the patient, and to give you an idea, in 5-7 minutes, I ought to be able to chart my whole encounter when I check them in, assessment and everything. And right now it takes about 40 minutes.
Wow.
To get it entered.
So can I ask one question? Can I ask a question, though, as far as this is more for public comment or thought of the community understanding? What advantage for us is it to bring paramedics into the hospital, as far as staffing our hospital? I mean, we've talked about a little bit more, but for the public to understand, what is the benefit? Val, what do you feel there about that?
The benefit is these are individuals who are used to working with little resource, and their focus is the patient. They don't as much worry about their charting. ER nurses are very charting oriented because we feel like we need to get everything documented. And the paramedics are used to taking care of the patient and charting everything later. And they look at, they're looking instantly at assessment. They can look up at the camera and see the patient in the waiting room. ER nurses do as well, but paramedics do it even quicker. They're instantly looking. They look like they're having labor breathing. They look distressed. They look, they don't look good. And they don't really know why. They just know it just from a glance. But that's what they're used to. They're used to going in someone's house. Our medics starting IVs, technique-wise, they're very talented. They're used to doing it upside down in the rain in a car, and to do it in an ER with all full supplies is easy for them. Their challenge has been there are things that we do that they've never done. Putting in catheters in a bladder, dressing certain wounds in a certain way, suturing, they've never been exposed to that. And I think they're kind of digging that. They really like it and have a better appreciation for that side of it. But their assessment skills are very good. If I said to any one of them, hey, what am I going to run this Cardizem drip at? They can instantly tell me. I would have to go, hang on, let me look. But they know because they're used to having to do it on the fly. And they're used to an intense, short encounter, so they're very oriented to how fast we can get this patient taken care of and get them in and get them out. And how are we going to get them home? Their focus is just a little different for them. And as far as a teammate, they're used to working as a team. On a truck, you're an EMT and a paramedic. Or, you're used to your partner being your other half. And a lot of times ER nurses are so busy, you're very isolated. You're much on an island. You're not used to having a partner. And we've seen that super bit. Like I watch them come in the morning, they start emptying trash because they're also used to working in a fire department. And they take care of their own trash, and they clean their own stuff, and they wipe everything down themselves, and they check they're used to checks and making sure everything's there and everything works. And it's just a compliment for what we do. It's almost like they just pick up the ball and run with it.
Sounds like a great mix.
It does. And certainly there are things they can't do that state, won't let them do from a licensure standpoint, and we work around that beautifully. They're very task-oriented, which is beautiful. By the time we come out of the room from seeing the patient, they're already got blood drawn, got a line started, done several different things, headed down the road, trying to figure out what's wrong with them, because they're protocol-driven. They're thinking, where am I going? What are we giving next? And so they just have a different view. But the two together, I think, makes a very complementary patient care.
Is that typical or unusual for an ER room?
I think it's, when you put a medic in the ER, it is shown to be, the patient care is shown to be increasingly successful for that reason.
It's got to be a lot
They're
quicker.
much more attentive to the patients. I'm not saying as ER nurses we're not, but we're very focused on getting everything charted and the process, and they're very focused on making that patient happy because that's what they're used to.
Yeah, I like that idea. I think our local community, will just be ecstatic as they move forward, using the service of the hospital based on the fact those paramedics are there with the nurses and they work well together as a team. That's in our REH format, it looks to me like it's just a win-win situation as far as that relationship. So, and I'm sure that even the paramedics coming in with their patients, I'm sure there's even a good thing there when EMS shows up and they've got a paramedic there that understands what they've just dealt with and has a real clear understanding. That's pretty cool.
Well, it definitely increases our ability to take care of a sick patient because they're used to that. That's what their norm is. For them to take care of low acuity is easy for them, but they thrive in a high acuity patient. And in an ER that doesn't see a lot of high acuity, sometimes our nurses get a little complacent taking care of them. But the medics, because a lot of these guys still work on a truck. Well, the two we have, they both do work on a truck still for different places. So their high acuity assessment skills, the treatment skills, it's very good.
And they're beneficial to us if and when we get out to a mobile, community mobile clinic, too.
Thanks, Bill.
Right, Willie?
Absolutely.
Sharon, did you have a question? Okay. All right.
I do have a question. Just move back. What electronic medical record system does the hospital use?
It's Oracle.
Oracle? Okay.
Yes.
It's
Used
not
to be
Cerner or...
Cerner used to be, Oracle bought Cerner out in
24.
23.
23, late
Because it
23.
was right in the middle of us actually signing and executing the agreement. Because hindsight was like, if we would have known that, it was kind of, but yeah. So we're in Cerner Community Works, but its parent company is Oracle. So yeah.
That was part of our chaos last year because we went from MedHost to Cerner, who were hospitalists. And then Oracle bought it, and then they pulled the Cerner people who had been working with Cynthia and the staff and put in Oracle people who had no clue. And that's when things got missed. That's when things got, no service, one of those. I'll get with my boss, that'll get with his boss, that'll get with her boss. And that was the headache that they were fighting through August of last year.
With the claims side, we dealt with it through October and into November, that we had claims kind of held up in-house just from basic claim rules not being built in a standardized system that was nothing specific to an REH or our facility. They were industry standard, so we had a lot on that side. So
We most likely lost some billing, not most lost.
we did have some that we had to write off for timely filing because we couldn't get the claims out the door. Some of the insurances have went to 90 days for timely filing, so and by the time we got some of that kind of cleared through, it was, into the fourth quarter of '24, so.
And they took our designated help staff away and just sent us to the not random, but just the regular help desk for anybody who had no idea what we were doing. So we had no contact on the other side month after month.
Yeah.
We instituted a new program, and the backup people were sucked up by the new owner immediately. And so we were left holding a bag that was just...
And the reason we made the change...
We're still working our way with some of the...
And the reason we made the change, not only was MedHost an antiquated system, but Cerner had the healthcare specialty. That went away within 2 months.
Oh, wow.
So, yeah, I'm surprised they still have hair. Any other comments or questions for Velvet or anybody? Okay. Jody, do you have anything you want to?
No, ma'am.
No? You like those answers. Okay, we're at the point of commissioner comments. Sharon?
I don't know. I'm just excited about the changes and the direction that we're going. I think it's pretty exciting. Yeah.
Thank you.
Good job, everybody.
David?
I have to agree. I think we're making progress. What you guys are doing, and just the way the numbers are going, and the great opportunity to clarify to the public that we've been through difficult times, and we're doing the things you do to come through difficult times and make it, even in the uncertainty of the current world.
Yeah. Willie?
Yeah, I think the main thing I'm seeing is, there's a misconception about what we do here and what the hospital does, and I see a lot of positive here. So I would just like to see that translated to the public, to the city, and to those people that need to hear it.
Kate?
Great job, you guys. And your charts, I think, are going to help everybody see our financial turnaround. It's just right there in red and blue and yellow. And so, yeah, great. Thank you for doing that.
Red and black.
Yeah,
Brian?
that looks good. And just my hat's off to y'all. I just feel like where we've been and where we are now is, I don't want to say night and day, but it's a huge difference, and it's all because of you and your commitment. I mean, that's all I can say. It's you and your commitment. You two have been through the thick and thin of it, and look where we're at today because of that effort. And Velvet, having you on board, it's just a great thing. It's a great thing for Eureka Springs, and I think it's going to, in the long term, people are going to look back and say, wow, what a group of people leading and running that hospital.
See if Vivian's here. Vivian, do you have any comments you'd like to make?
I'll be back in September, so I'll be able to attend the meetings in person, which will be nice because I miss a lot of it when people are talking. But I'm sure that I will echo the sentiments of all the commissioners because I heard some positive comments there. So thank you, Sandy, for all the time that you're putting into this as well.
Thank you, and it'd be good. I hope we recognize you when you get back.
I did get older.
Oh, well, didn't we all? Just for my parting comments, I've shot my wad on fact checking and everything, but I just want to say with Tiffany in place, work with her closely, and 2 observations. One, she is a phenomenally easy and effective and consistent communicator. She is completely thorough, completely honest, completely transparent. She is thrilled with the team. They have built a good, strong team. We have talked a lot about that and building. She's working on her 30, 60, 90-day plan. I would imagine it's going to be pretty dynamic and exciting for us with her experience, but she still has a whole bunch of assessing to do and research to do. So I just wanted to let you know that and she will be staying here 4 nights a week during the week, and then driving back home in Fayetteville on the weekends. She has a tendency to come in at 6:30 in the morning because she thinks it's important to meet with and mix with the night shift. So she is a working CEO, not a sit-in-your-office CEO. She does rounds, she travels, and I think the feedback I got on the one-on-ones that she had with the team, they were all excited. They felt, most importantly, they felt comfortable. And I think a lot of that is that they have confidence in her ability. She is an expert in her profession. And not disparaging any of the people in prior administration, but we have never had experience at this level before. And that's coming through, and I think the staff is responding to it as well. I'm duly impressed with the interaction that we have had, and she's anxious to interact with any of you at any time. And I know she communicates and does huddles with the staff all the time. So, and she's a bull on documentation. She's gone through enough management issues, and saving hospitals, as well as CMS and state surveys and everything, that she knows the importance of clean, clear, immediate, timely documentation. So I think that adds even more to the excitement in the future of the hospital that we have. So that's all I have. One thing I want to clarify, our next workshop was set for September 1st. I put a calendar together and shared it with you all that had holidays on there for a reason, but who looked at it? Not me, because that's Labor Day. So we will not have the workshop there then. My suggestion would be, instead of rescheduling it, because we're so close to getting the Forvis audit and starting the 2026, that we just cancel that workshop on the 1st of September and then pick
Since
our
we have one this week again anyway with the council,
Correct.
it's almost basically.
Right. Is that okay with everybody? Yeah. Okay, so there were no workshop in September. Then our next regular meeting would be September 15th. We're looking at the September 23rd or 24th for a special meeting with City Council in Forvis. And then we have this Thursday at 10 a.m. here at the Odd. We have the Council Commission workshop dealing with financials and any other questions they might have. Anything else? Anybody want to move to adjourn, or you want to hang around?
Move to adjourn.
Thank you.
Second.
Thank you. All in favor?
Aye.
Thank you all very, very much. You guys for me to sign? Okay. Thank you, Vivian.